Well, filler is a big trend right now. One of the most common fillers that we see in our area is lip filler.
But our Brogan Morris wants to make sure you're all aware and being safe when it comes to getting those injections. And she spoke with a plastic surgeon about some of the risks and what happens if you maybe go a little too big on the lips.
Hey guys, it's Brogan with What's Good For You. I'm here today with Dr. Edward Davidson, who specializes in plastic surgery, which is what we're going to be talking about today. So one thing, it's kind of a trend taking over right now, is filler. And from my understanding, it can be used for a variety of things, but one thing is aging. So let's talk about maybe a little bit of pros and cons of that.
Absolutely. So what we're seeing is an explosion on the aesthetics industry, and when you think about aging, we're seeing characteristic changes that filler can help address. So we see volume loss and then descent of tissues because of time and gravity. So you're talking about areas of the cheek, the crease, what's called the nasolabial fold, the marionette line, jowling, and some fullness in the neck. And filler can address all of those things to some degree.
So basically, you feel like your face might be going in a little, and it fills it out and kind of gives you that youthful look, right?
Yes, but I would say that when you're thinking about those changes, you want to think about the severity. So obviously filler's not going to be able to adequately address very significant things, but for minimal and mild changes, absolutely.
Now what are some of the dangers with that?
Right, so I think one danger is, like I sort of just alluded to, doing too much, expecting too much. If you have a sort of significant change that maybe needs a surgical correction rather than just camouflage, filler's going to be inadequate. I think that making sure that filler is done in the right way, that's respecting, anatomic areas, especially blood vessels. When filler gets into a blood vessel, it can block that blood vessel and cause tissue damage, create a wound, and obviously it's important to make sure that that's not happening and that filler's injected in a safe way.
Great, and then I think that the other major trend right now, especially in younger women, is lip filler. And I want to talk a little bit about maybe some pros and cons of lip filler specifically. Yeah,
lip filler seems to be super popular, and it's definitely a different kind of paradigm to the age-related changes, because people are doing it when they're younger, and they're doing it not necessarily to affect differences in age, but really just to augment or enhance something that's already essentially normal or natural. And I think one of the dangers that people can get into is putting too much filler in the upper lip and not respecting the ratio of the upper to the lower lip. The lower lip should always actually be a little bit bigger. And I think if you put too much in the upper lip, it can look unnatural.
Yeah, absolutely. And I know that there's a little bit of a trend of people doing it in garages and at home, and I think that that's probably...
There's definitely some horror stories out there, whether it's non-medical grade fillers being used or them not being used in a medical setting, a garage, a hotel room. All of those should be red flags for potential patients.
So see someone who specializes this and make sure that everything is good to go.
Absolutely. A board-certified plastic surgeon or a facility that has a board-certified plastic surgeon as its medical director.
And last question, let's say you do too much filler and your lips are looking a little on the large side. Is it reversible?
So it depends on the filler. So when you think about filler, you want to think about the material. So certain fillers are reversible. The hyaluronic acid-based fillers, you can reverse that with an injection called hyaluronidase, which can dissolve it. The other thing to think about with filler is how thick the filler is. There are some fillers that are permanent, and they are not as easily reversible.
So that is something good to know, because one day you might be feeling like you want some big juicy lips, but it's good to know that you can lower it down if you do it right. Well, thank you so much, Doctor. This was really helpful, really informative, and that's what's good for you.
Yeah, I feel like anything you're doing for aesthetic purposes, you got to know who you're going to, you got to talk to your doctor about what you want. I mean, it shouldn't get out of control in the first place.
This is not also a DIY.
Not in your garage.
Lip filler.
No.
All right, next.